Hey Tayton, my name is Aiden. I'm the student physiotherapist here today. I'm just going to ask you a few questions, and whilst I'm asking you these questions, I'm going to be writing it down, alright? Writing down some notes, alright? Are you happy to continue?
Mm-hmm.
Yeah, cool. So can you tell me a bit about why you've come in today?
Yeah, so about a week ago, I was playing a soccer game
Mm-hmm.
and I just kicked the ball and twisted my ankle outwards
Uh-huh.
and it swelled up immediately and it was
Did you
very
say
painful.
outwards? So,
Yeah.
so just show me. Alright,
Like that.
alright.
It swelled up immediately
Yep.
and the pain was really bad and it's a lot better now, like I'm able to walk on it and stuff.
Mm-hmm.
And I do have a soccer game coming up next week
Okay.
and I thought it'd be best to see with a physio if it's alright to play.
Right. Okay. So that would be one of your goals to figure out whether you can or can't play.
Yeah.
All right. All right. Can you tell me where the pain is? Can you show me where
Yeah,
it is?
right. I can pinpoint it right here.
Yep. So just in that spot.
Mm-hmm.
Yep. Nothing below that point.
No.
No. Anything at the knee, for example. No. No hip pain.
No.
And anything on the other side.
No.
Awesome. All right. So we have this scale, 0 being feeling no pain, and 10 being feeling the worst pain you've ever felt in your life.
Okay.
All right. So whilst you're sitting here right now, how would you rate the pain?
About a 2 or a 3.
2 or a 3? Okay. And when you're doing movements that aggravate the pain, at its worst, what rating does that get to?
About a 6.
About a 6? Cool. Alright. Alright, let me just write that down. Do you feel anything other than pain in that area?
No, not really.
So no pins and needles, no numbness?
Nope.
Alright. Cool. And how would you describe the pain?
Well, at the moment, it's a bit tender around the area that I pointed out,
Mm-hmm.
but where I pinpointed it, it's like when I move my ankle to a certain angle, it's like a sharp lightning bolt of pain.
Alright. And that's where it goes up to that 6 out of 10 sort
Yeah.
of feeling? Yeah.
Mm.
Alright. Now, when you do movements that aggravate it, how long does it take to settle back to 3 out of 10?
It doesn't take too long. I don't think maybe about 5 to 10 minutes. It's okay.
Yeah. Alright.
As long as I rest it.
Okay. But if you were to move your foot out, I'm just thinking about the examination that we're going to do later on.
Mm-hmm.
If you move your foot out and there's that sharp pain and you move it back to neutral position, does that pain go back to normal immediately, or does it linger there?
It lingers for a little bit.
A little bit?
Mhm.
Okay. How long's a little bit? Like,
About 2 minutes maybe.
cool.
Yeah.
Alright. No worries. Alright. So, could you explain to me how the injury occurred? So what actually happened on the day?
Yeah, so I had just kicked the ball really far and I stepped off the kick
Mm-hmm.
and I just stood at the wrong angle and my ankle completely twisted.
Alright. Okay. And so on the day, were you able to walk off the field?
No, I had 2 people assist me off the field.
Okay. Alright. And what happened once you were off the field?
I iced it
Mm-hmm.
and then later after the game I went to hospital.
Okay. And what happened at hospital?
They took an x-ray
Alright.
and they didn't see anything in the x-ray.
Okay.
Yeah.
Do you have your x-rays with you by any chance?
Yeah, I do.
Awesome. So we might have a look at them later, if that's
Yeah.
okay with you. Right. Cool. Now, when it happened, what happened with the swelling, did it take a while to swell up, or was it immediate?
Yeah, it was quite immediate.
Mm-hmm.
Yeah, and it was fairly strong.
Yeah. So how much did it swell up?
Yeah, quite a bit.
Quite a lot.
Yeah,
Okay.
that's why I decided to go to the hospital.
Right. Okay. And so you say when it happened, you weren't able to put any weight in there. Right. That's why you have an X-ray as well. Awesome. So let's just have a look at your foot now. Right. So you'd say the swelling has reduced quite a bit?
Yeah,
or?
it has.
Yeah. Okay. Awesome. And what sort of activities are you able to do now?
Yeah, I'm fine with walking. Just long periods of time of walking.
All right.
Gets a bit tender. And I haven't tried really running yet.
Okay.
Yeah.
But you don't need any crutches to walk or anything?
No. I did for the first 3 days though. But now
Yeah.
I'm off and it's a lot better.
Okay. All right. Alright. And also with the pain, did you feel what sort of activities did you do to make the pain feel better?
Definitely just resting it and lying down
Mm-hmm.
and nice warm baths and stuff.
Yeah.
Yeah, helped it a lot.
Okay. Alright. Cool. So who do you play for a soccer team at school or in a club?
It's a club.
It's a club, yeah. And what sort of team were you in? Were you in first grade team, second grade?
Just
Do you
second.
have just
Yeah.
second grade, yeah. Okay. So is it very important that you play this next game?
Not necessarily. Just if we don't have enough players, then it'll be quite important.
All right. Okay. Okay. So let's see what else. Do you have any? Has this ever happened before?
No.
So you've never sprained your ankle either side? No. And do you have any other conditions such as diabetes or?
No.
All right. And are you on any sort of medication?
No.
No. Did you take any anti-inflammatories when you injured yourself?
Yeah, I took Panadol mostly.
Yeah. And how long did you take Panadol for?
Mostly for the first 3 days. I was on crutches because that was when it was most painful.
Right.
But now
Okay.
I'm off it and it's fine.
Okay. During my physical examination, I observed the swelling and location of the pain. The area of pain was on the anterolateral aspect of the left ankle joint. There were no visual deformities, and although the area was slightly bruised, the swelling was not significant. I then palpated the area of the pain and assessed whether there were any abnormalities, which there weren't. Passive range of motion and active range of motion was observed, and the patient reported slight tenderness whilst performing some of these movements, but nothing over a 3 out of 10 pain level. This shows that most of the inflammation phase has passed. Quick tests included walking, followed by running, an MMT of peroneus longus and brevis, as well as tibialis anterior was completed. Special tests included the Taylor tilt test, compression test, anterior draw test, and the tibial external rotation with dorsiflexion test. All these assessments were done on both sides or both ankles to compare. Due to the injury resulting from some sort of trauma, my differentials included CFL sprain, ATFL sprain, syndesmosis injury, some sort of muscle strain, and possible fractures. I have come to the conclusion that it is a grade 2 ATFL sprain, mostly because the patient's pain is very specific to that ATFL region, and the pain did not move. It stayed in that area. No significant increase in pain or decreased strength was apparent when the MMT tests were conducted. Only the anterior draw test for the ankle increased the patient's pain. and the patient did not report any unusual symptoms such as numbness or pins and needles. The patient is also young and has no previous medical conditions. It is a grade 2 because the patient's swelling was significant at the time of injury. However, her pain was significantly reduced in a week. She is able to walk with little discomfort, but there was quite a bit of discomfort when transitioning to run. Her x-rays also did not show any fractures. Assuming my diagnosis is correct, my management plan for my patient would be as follows. I would say, Tatum, I would advise that you continue doing your exercises I've given you. They mainly focus on getting your full range of movement back and improve your balance, coordination, and strength in your ankle joint. It's important you do them because these injuries tend to reoccur, so we want to get it right the first time. As for the game that's coming up, I recommend sitting this one out until you are confident doing the more difficult balancing exercises I've given you. I also recommend purchasing an ankle brace for future training sessions and games. Thank you.